And good morning. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute here in Florida. Our patient travels here with two damaged discs, L4-5, L3-4. We're going to go in and repair both. Now, he's traveling here from Mississippi. All right, we're going to do a little injection. First, I'm going to inject his skin on his back. He's laying down facing the floor. I have to go and make a small incision on both sides, and I'm going to first put some numbing medicine. Now, when you see patients that are having awake surgery, they're receiving a combination of medications from the anesthesiologist, in this case, Dr. Berndes. And those medicines sometimes put the patient asleep, however, the body still moves. And the reason for that is called reflexive movement. People do move their bodies even when they're asleep. And so if they feel a little painful stimulation, he may end up moving his body. It doesn't mean he's conscious or awake. Okay. Now that looks like we're a little higher than I want to be, so I'm going to come down a little bit lower. Our target on the right side is L3-4 and L4-5. Show us the L4-5 disc, Jordan. That is correct, Sean. All right, so my needle is heading directly to L4-5. He has a herniated disc on both sides at L4-5, left and right. He's having leg symptoms on both sides at L4-5. So we're going to go in and unpinch both sides by unpinching the nerves that run right behind the disc. He also has back pain, but his biggest problem is his legs, and that's the main reason he came to us, was fixing the leg symptoms. Sean? All right, you can see the needle tip is right near the facet joint at L4-5, which is full of arthritis. Show us that, Jordan. You guys see that? Circle it. Circle the facet. That big thing there is a facet joint. It's a little joint in the back of the spine, but his is enlarged, much bigger than it should be. Sean? All right, let's get an AP view. AP is a front back. You guys are seeing a side view. We're going to switch the view to front back, because when you're doing this surgery, you have to guide the needle, but you must use two views, front, back, and side. Front, back, and side. Those are the two views. So you need to create a three-dimensional image of what's happening in that patient in the surgeon's mind, and to do that, I must get different views, okay? All right, I may be hitting the transverse process. Let's see, I think I'm just hitting the facet though. Sean? All right. Almost there. Yeah, Sean? I may have to change my trajectory. I think I will have to come a little bit higher than I was so I can avoid the transverse process. Sean? All right. Let's see if we can get around this, Sean. So right now I'm trying to get around the facet joint. The facet joint is super big, and I am trying to work my way around it. Sean? Almost there. That's what happens when bones start to get enlarged. AP? If you have questions, feel free to ask me. In the meantime, while we're accessing these three areas, I would like to share with you all. You guys see the facet there?
Yes,
Jordan,
we do.
show them the enlarged facet on the AP view. That's the pedicle. Nope, the facet is lower. There you go, there, and circle it. It's huge. Yep, that's it, even bigger than that, all the way down below. Bigger, bigger, down below, yep, that's the facet. It's too big. It should be about 25% of that size. So it's 4 times bigger. So I'll get around it, but you can see the tip of the needle right there is just hitting on the bone of the facet joint, the enlarged bone. So I'm going to have to go a little bit, tiny bit more lateral than I was. So I'm going to move my entry point, Sean, a little bit lateral. Sean, our patient is comfortably sleeping. You got it there. Sean? Sean? Watch my fingers. I don't want to get radiated. Sean? Any questions?
At this moment, no current questions.
All right, why don't you show them the 30 different causes of back pain while I'm accessing these 3 discs transforaminally. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. As you can see from the X-ray images, we have placed 2 needles The first one at L3-4 on the right, the second one at L4-5 on the right. We're placing the left L4-5 needle. This patient has a big herniation at L4-5, annular tear, bulging disc, lateral recess, and foraminal stenosis, leg symptoms as a result from the nerve roots being crushed by the herniation. L3-4 on the right side, there's a herniated disc pinching the nerve as well. So we're going to go in there, use the laser to clean out those herniations and clean the tear where the herniations come out of. I'm just about done. Any questions? You've watched our video on the 30 different causes of back pain. This is chronic back pain that, people have for more than 6 weeks. That's what chronic means. You can see this is a bloodless surgery. This is all the blood we've lost. It's like 5 drops of blood. This patient takes some omega-3 fatty acids. We stopped him taking a week ago, but it's still in effect on the platelets. Those fatty acids do thin the blood. All right, we're going to do a discogram. We're going to inject a little bit of dye into the disc just to see the tear to help me do the surgery. You can see the tear shot at the top one. All right, there's the tear. You see the arrow. It's showing you the dye within the tear in the back of the disc. It's a big tear. Jordan, can you measure that tear? How long is it? You guys can see that tear really good. Show us the inside of the tear. Right further, right there. That's where the tear starts, and then it extends all the way to the end of the disc. What's that distance, Jordan? We're going to try to measure it so you guys can understand how big these tears really are. Jordan is working his magic. It's in pixels, 71 pixels. How do we change from pixels to millimeters? All right. Well, we're going to figure out how to convert pixels, but if you ask me, that's around 2.5 centimeters, so around 25 millimeters. We're going to do the next disc, shot, L4-5, shot. All right, and there's a tear there as well, and a herniation. So we're injecting this dye. It's a blue dye, the Duke Spine dye. It stains onto basically herniated disc fragments that are degenerated. Any questions? 1-to-1?
At this moment, no current questions.
You think it's 71 millimeters? No, can't be. No questions. All right. Then Henry,
Yes, sir.
shown our audience the video shot.
Yes, we have.
On the 30 different causes of back pain.
Correct.
And these are causes that we discovered here at Duke Spine as the 30 causes. They account for basically 99.9%. That's 100% of all chronic back pain. They include disc injuries like this patient's. They include facet joint arthritis. They include sacroiliac joint dysfunction and piriformis muscle tears, as well as fractures of the spine that are vertebral body compression fractures, and tumors and infections. So if you take all of those causes, disc, facet, sacroiliac joint, piriformis muscle, fracture, tumor, infection, that is literally 99.9% of chronic back pain. And we don't fix tumors and infections at Duke Spine, but we fix everything else, which accounts for 99.5% of all chronic back pain. Many patients, like this patient, also have leg weakness, numbness, and pain from pinched nerves. And that's what we're treating in his case. Hold on. All right. Shot. He has a big tear at L4-5 disc, and that tear in the annulus or wall of the disc is allowing the nuclear material, which is the jelly in the center, to come out through the tear and basically pinch the nerves going down his legs. It also causes back pain through inflammation. So we're going to clean out that tear, get rid of the herniation that's stuck in there. It's called the interposed herniation. Interposed means between the tear fibers, interposed. And that is the source of back pain in 85% of people. The primary source of back pain in 85% of people with chronic back pain. That inflammation in the annular tear. That's what makes our surgery unique. There is no other surgery in the world that targets the tear in the back of the disc and the herniation stuck in the tear. All the other surgeries target the herniation outside the tear that's in the epidural space or neuroforamen. And those surgeons are only treating leg symptoms, not back pain. You must target the posterior annular tear, herniation and inflammation to get rid of back pain, which nobody in the world has ever done. We're the first. I'm the first person to do that. I'm the pioneer and discoverer of that. And that's the Duke laser disc repair you're about to watch. If you have questions, feel free to type them up.
We have a question coming from Pure Honest, Very Caring on Facebook.
Welcome back, Pure Honest and Very Caring on Facebook. Nice to have you back this week.
Asking, after surgery, how long this area remains weak, and how do we gain back all the strength after surgery? Will it feel regenerated, or will it need a lot of time? Because sometimes they say if we start lifting weights, there's a possibility to herniations might come back.
So this is a really good question. Our surgery is the least invasive of all spine surgery in the world. There's nothing less invasive. So the recovery from this surgery is literally 1 hour, and overnight the pain from the surgery is gone by the next morning in 90% of our patients, 90%. 10% of the patients still have some pain from the surgery for a couple of days, but 90% of the patients, the pain is gone by the next morning, and they're 100% back to normal with zero back pain and zero leg symptoms. Now, the disc itself does take time to heal after surgery, but it's a painless process. You don't even know it's healing. It takes, I would say, 9 months to a year to fully heal. The reherniation rate, which is what you're talking about, the chance that the patient can squeeze out another herniation before the disc is healed, is 1%. That means 1 out of every 100 patients will reherniate. But I can tell you that's always because they're lifting something heavy after surgery. If you listen to our restrictions and don't lift anything over, say, 40 pounds your first year, you will not reherniate. It's only, this is a piece of herniation, by the way. It's only people who don't listen to our instructions, who do too much too soon with lifting, those are the ones who reherniate, okay? So if you just follow our instructions, you will not reherniate. This blue stuff is the hernia right here. I'm pulling it out. It's so easy, guys. See that? This is a bloodless surgery. There is no hospital. There are no pain medications afterwards. Every other spine surgery in the world, besides the Duke laser disc repair, requires pain meds to be used by the patient after surgery. Those pain medications are called narcotics, and narcotics are dangerous. They can cause you to stop breathing, and you can die. Many people die after surgery of the spine because they take too much of the narcotics because they're in so much pain from the surgery itself. Now, why do people get pain from spine surgery? The answer is the surgeon is cutting their back open and doing a lot of damage to their muscles, their ligaments, their body, and all that damage, well, it causes inflammation, and that inflammation causes scar tissue. That's what causes your pain, is the inflammation. That inflammation from open invasive spine surgery can last for weeks or months, and that's why people who have invasive spine surgery are usually on painkillers for months. They can't go back to work. They struggle with life. Duke laser disc repair, what you're watching now, requires no painkillers whatsoever. This stuff here that we're removing is all scar tissue from inflammation that's been going on inside his disc. Remember that tear I showed you with the dye? Well, that's what we're looking at right now. That's the tear. And his body's been trying to heal it unsuccessfully for like 30 years. That's what we're seeing is 30 years of scar tissue. If he would have come to Duke Spine Institute 30 years ago, none of this would have happened. he would have been fixed right away. The problem is we weren't doing this surgery 30 years ago. We didn't exist 30 years ago. So it's not his fault, of course, but you people understand what we're saying, and you have no excuse. You're watching our surgery. So if you have a back problem, there's the tear right there, and look at the herniation inside the tear, the blue stuff. If you have a back problem, come to Duke Spine, get the right surgery, avoid invasive spine surgery like laminectomy or fusion or discectomy or disc replacement. Those surgeries don't work. They're very invasive and cause horrible pain and a long recovery. The reherniation rate for microdiscectomy, a surgery we do not recommend. That microdiscectomy reherniation rate is around anywhere between 10 and 50% reherniation rate. With Duke laser disc repair, it's 1%. So we are far better option for people with a disc problem than microdiscectomy. Henry, why don't we show the audience what a microdiscectomy is and why it should be avoided?
Of course.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
And welcome back. You can see from watching the animation of a microdiscectomy, or discectomy is the other term, the surgeon must make a big incision, which takes a long time to heal and it's painful. They have to peel your muscle off your spine. Basically, they kill the muscle during the surgery, which we don't do here. We make a small incision and we do not take any muscle out at all. With the microdiscectomy, the surgeon must drill away your bones, the normal bones in your spine. By taking away your lamina, it basically opens a hole in your spine and destabilizes your spine. The surgeon also has to remove part of the facet joint. Did you guys see that? Facet joint being removed with microdiscectomy. We don't do that with the laser surgery. There's no facet joint removal at all. So we're going around the facet joint, not through it, like the other microdiscectomy does. And then finally, the surgeon has to remove ligaments from your spine with the microdiscectomy. We don't remove any ligaments from your spine with this surgery. So all we do is go around the facet, around the ligament, around the lamina, around the muscle with this type of surgery. So that's why it's much better for you. There's no downside to the Duke laser disc repair at all. It's actually better on all counts. It's a safer surgery. We've never had a complication with this surgery in 19 years of performing it here at Duke Spine. Never had an infection, never had nerve damage, spinal fluid leak, instability or adjacent segment disease. Those are all things you're going to get with microdiscectomies and laminectomy. So it's a much better surgery. We get a lot of people asking, if it's so much better, why don't other surgeons do it? The answer is, well, it was discovered here at Duke Spine, so other surgeons can do it if they want to, but they have to be trained. And training means they're going to have to quit their job and leave their family and come to Duke Spine Institute for a year and train with me to do it. And most surgeons don't want to do that. They don't want to, they're making, $700,000, $800,000 a year. They have a practice with lots of patients. They don't want, there's herniation right there. They don't want to leave their families, their homes for a year just to come here and train with me. But so that's why it's not so popular. Plus, right now the insurances, a lot of them won't pay for the surgery. They have to pay, patients have to pay out of pocket, so it's really hard to get people to pay out of pocket. You know, and those surgeons just want the easy money that they get with fusions and laminectomies. So there's a lot of reasons. Unfortunately, they're not good reasons for patients, but there's reasons why other doctors don't do this surgery, but they're really financial reasons and you know, quality of life reasons for the doctor, but not for the patients. This is the best surgery for patients. Someday when all the surgeons are trained to do it and they're getting paid good money to do it, they will do it. But that shouldn't be why you don't do it, right? You want what's best for you, the patient. You should be asking for the best surgery, not for you, not the best surgery for the surgeon. Okay, here you go. We'll take the question.
Question coming from Scott on LinkedIn.
3 minutes on this disc. All right, I'll take Scott's question on LinkedIn. Thanks, Scott, for joining us, by the way. And it's good to have LinkedIn followers and viewers.
Agreed. Much agreed there. Scott asked, recently I took a large amount of oral L-glutamine before and after oral surgery, and wow, the healing was much faster than the prior surgery. Light night and day, no one believed it. I know we chatted about doing some research about IV L-glutamine before releasing the patient. Did anyone follow up with PubMed research? Like night and day?
Great question. As a matter of fact, yes, I had Dr. Berndes look into it. And Dr. Berndes and I are still assessing the value for patients of performing it. It's not that expensive, right, Dr. Berndes? It's not an expensive drug to administer, so it's not a cost issue for us. It's really an issue of safety for the patient. So whenever we add something to what we do as doctors, we want to make sure there's a benefit to the patient for adding that. And right now, we can't see that there will for sure be a benefit. We appreciate your experience, and I do believe you. I really do. I believe you. However, the recovery from this surgery without L-glutamine is so fast, it's really hard to justify bringing in an unknown factor. Now, yes, when you had your discectomy surgery, that's a painful recovery, right? But with this surgery, the recovery is 1 hour. So whether we add L-glutamine or not to the recovery regimen, we don't know if it's going to help the patient or hurt the patient, but more importantly, let's assume it helps the patient for a moment, just for discussion. How much more help could it be if your recovery is an hour? Right? I mean, people are feeling great in an hour when they go home. So why give them something when we're already getting amazingly good results? That's for large wounds, wound healing. Yeah, Dr. Berndes says it's good for people with large wounds. We don't make a large wound. Our wound is 4 millimeter or 7 millimeter. So it's really hard to justify adding something to the treatment of the patient that could potentially have a side effect, we don't know, when there's really already we're getting phenomenal results. Does that make sense? So anyway, that's why we haven't yet incorporated it. Now maybe for fusions we would do it, we would consider it, but we're not doing a lot of fusions anymore. All right.
We have a couple more questions.
Sure, I'll take them.
Next one is coming from Michael on Facebook.
Sure. Hi, Michael. Thanks for asking a question and joining us from Facebook.
Saying, hi, Dr. Duke. Hope you have been well. I have always been curious as to why, when performing a bilateral DLDR, you don't retract the needle slightly to avoid hitting it with the laser. Is this because you risk losing the needle placement?
No, great. Yeah. So, number one, thank you for asking that question. It's incredibly insightful. It's a great question. So to answer your question, yes, we do retract the needle slightly. We absolutely do. And yes, the risk is that we pull it back too far and that it's outside the disc, and then we lose it. We lose that positioning. So yes, you are right on both accounts. But we do retract it, and we are worried about losing positioning if we retract it any further. So great points. I agree with you. All right, we're just about done. Look at all that scar tissue in the annulus, and look at the inflammatory tissue at 12 o'clock. So we're just at the outside of this herniation. This is the part that was pushing the most on the patient's nerve roots, causing his leg symptoms and also causing back pain. But I can tell you this scar tissue is very thick, very, very thick. And for those of you who watch these surgeries all the time, you can see just how thick it is. And it's calcified. It's so old that the body is starting to turn it into it's starting to harden it with calcium. So the laser fiber that I've got here, by the way, that you're watching, is literally 1 millimeter thick. Okay, just to give you an idea of the scale of things. We're inside the endoscope, so the endoscope is blowing up this picture, making it look bigger. That's why you can only do the surgery endoscopically, but with a laser. There is no other tool in the world that performs as good as the laser. If the laser is the very best, and I'll give it a 10 out of 10 for tools during the surgery, then every other tool is around a 4 or lower. That's my assessment of the value of the laser for this type of work. It's so precise. People worry about the laser. Oh, doesn't it heat up? No. It heats up normally, yes, but not under these circumstances and not this type of laser. This is a special medical laser. It's called a holmium YAG laser. The machine itself is the size of a large suitcase, and it is in the operating room near the patient's feet. It takes 220 volts to operate, and it generates a very powerful up to 100-watt laser beam, which we have it running around 50 watts right now. You don't need full power. But the more scar tissue there is, the higher we have to turn the laser up to vaporize the tissue. Now, what does the laser do to the tissue? It breaks the bonds between proteins. It breaks the bonds between fats and carbohydrates. These bonds are called covalent bonds for the biochemists out there. Covalent bonds are the strongest types of bonds in living matter. The other types of bonds are ionic bonds and hydrophilic bonds, which use what are called van der Waals forces. But these bonds in biomaterials like proteins, muscle, all the stuff in your body, connective tissue, all your bonds in your body are pretty much mostly covalent bonds. There are some ionic bonds, especially in bone, but most bonds in our bodies are covalent bonds. Okay? The bonds here in the scar tissue are covalent bonds between the collagen fibers, which is a protein. That's really mostly what we're dealing with here, is collagen, which is the main component of scar tissue. I'm just got a little more to go, and we're done with this right-sided L4-5 disc. Any other questions?
Yes, we have a lot more questions. This next one coming from Pawnlust on YouTube.
Hi, Pawnlust.
Asking,
Got your YouTube comments. Thank you.
and
I think I responded to them yesterday or the day before.
Awesome. Asking, does your surgery have access to the subarticular herniation / lateral recess in the cervical spine?
Yes, our surgery has access to all herniations. The only ones it has trouble with are migrated herniation that migrates up behind the facet joint. And those are extremely rare types of herniation. So 99% of herniations, our surgery is the very best to gain access to the herniation.
Next question coming from Scott, once more on LinkedIn,
Hi, Scott.
asking, will the herniation heal if you have to leave some of the scar tissue? Does
Yeah.
less scar tissue faster healing, and is the converse true?
Yeah, great question, Scott. Really, really good, insightful question. So Scott's asking a great question, and it's a very complex question, and it requires a complex answer. Scott's saying, if you leave scar tissue, does that affect the healing one way or the other? So here's the answer. The disc heals with scar tissue. Okay? The disc heals with scar tissue. Scar tissue is collagen, collagen. It's a protein. It's made by a special cell called fibroblasts, and those cells excrete collagen right here where we're operating, right where this tear is. Okay? But you see this? I'm taking out not just collagen and scar tissue, I'm taking out herniation. It's not the scar tissue here that's blocking the healing. It's the herniation that's blocking the healing. And the herniation is embedded into the scar tissue. I've got 1 minute left on this disc. So it's not, when I say we're removing the scar tissue here, yes we are, but it's not the scar tissue I'm interested in removing, because that's coming back when we're done. I'm interested in removing the fragments of nuclear material embedded in this scar tissue that are causing inflammation to occur. Once you get rid of those pieces of nucleus pulposus, which you're seeing little pieces come out, then your body can heal this with scar tissue properly, and there will be no inflammation and pain. All right, there's your tear right there. That's where the herniation was sitting. Remember, the laser fiber is 1 millimeter, so we're looking at about 3 or 4 millimeter wide tear left here. The body will seal it on its own. Okay, now that we've removed the herniation, there's some fat, and the nerve root is right there. You guys see that vein on there?
Yes, we do.
Okay, that vein right there is sitting on top of the dura, or white covering of the nerve root. You can kind of see it right there, just underneath. That is the nerve root. Specifically, that is the L4 nerve root. Okay, we're done. Yep. I'm going to move on to the next disc. I don't have any suction. I need suction. Scope off. Come on, guys. You're not doing brain surgery over there. I need suction. Sucky, sucky. Good. Let's remember to put the suction on. Checklist. It's weak, but it's working a little bit here. All right, what other questions do we have?
Next question is coming from Frank on YouTube,
Frank, welcome to our live stream. He's moving around a little bit.
asking, hello, Dr. Duke.
Hi, Frank.
When you remove the herniation using the laser, do you also remove any bone spurs in that area?
Yes, Frank, I do remove bone spurs with the laser. The laser I'm using melts steel. It can easily remove bone spurs. However, let me ask you a question, Frank. Let's say you own an acre of land, and on that acre of land you have a small garden. You're growing some vegetables. But most of the acre, like 75% of the acre, is just wild and there's no vegetables. All right, and you go out to weed. Are you going to weed the entire acre, or are you going to weed just the vegetable garden? I hope your answer is you would weed just the vegetable garden, because taking weeds out of the rest of the acre that has just weeds to begin with, there's no purpose. You see, there's no reason to do it. It doesn't add value to you. It doesn't help you in any way. The point I'm trying to make is I only remove bone spurs that are pinching the nerve or causing symptoms. I don't remove bone spurs because there are bone spurs there. Most bone spurs cause zero symptoms. You live with them, they're normal, they're like having hair on your skin, they don't cause any problems, and they're just visually, you don't like looking at them, but they don't do anything bad. They're not pathological. Okay? Now, I'm going to tell you something. Pathology is the study of disease. Okay? Surgeons treat pathology. That's what we do. We remove things that cause disease. Bone spurs, most of them, 99% of them, do not cause disease. Surgeons like to show them to people and say, look at the bone spurs. You need surgery to remove them because physical therapy won't remove them. Chiropractors won't remove them. Your primary care doctor won't remove them. Only a surgeon can. So they basically lie to people like you, telling you that you have to have all your bone spurs removed, then you have to have a fusion. But it's complete bullshit. It's nonsense. Do not listen to them. They're lying to you. It's unnecessary and it's dangerous. They're using that basically to get you to do their surgery. Okay? I used to believe the same thing when I was ignorant a long time ago. Well, when I was an ignorant neurosurgeon, I should say. But it's true. Most bone spurs just don't cause any symptoms and they should be left alone. I only take out bone spurs that are causing symptoms for the patient or, as I said earlier, disease. All right, next question.
Next question coming from Tom on YouTube.
Tom or Todd?
Tom.
How do you
T-O-M.
spell it? Tom?
T-O-M. Correct.
Welcome, Tom.
Asking.
Thanks. Uh-huh.
No, he was asking how long after this type of surgery can I lift heavy objects like 100-pound bags of concrete?
Well, Tom, all right. So you should not be lifting a 100-pound bag of concrete for 9 months. I'm going to say that as a generalization. Why? Because it really depends on what your herniation and your disc look like. So I need to see the MRI, and then I can tell you a better answer. But there are discs that when I fix them, the patient can lift 100 pounds within 2 weeks. And then there are discs where the patient should not lift 100 pounds for 1 year. So, and there's everything in between. But it really depends on what your discs look like. If you really want to know, do the free MRI review that we offer at Duke Spine, okay? Free MRI review. It's on our website. Go to dukespine.com. Henry will put a link right now in the dialog box. Click on it. Give us a little bit of information, back pain, neck pain, and then you're going to have to give us your MRI images. They're called DICOM images, and we need them so I can look at them. And I can tell you during our Zoom call how long it'll be till you can be lifting 100 pounds. That's the best way to find out for you, but I just tell everybody in general 9 to 12 months, but it could be a lot less depending on what your discs look like and how the surgery goes, to be honest. So, but I can give you a pretty good idea before surgery. Great question. Great question. Thank you for asking, Tom.
And at this moment, no current questions.
All right, so Henry, we have shown the audience the 30 different things that cause back pain.
Correct.
They're very specific. They're all fixable here at Duke Spine, except for we don't treat tumors of the spine. We don't treat infections. Okay? But if it's a disc infection, we can treat it. Otherwise, if you have a spinal infection like tuberculosis, very common in India, Pakistan, third world countries, then Duke Spine is not the place to go for tuberculosis. Okay? You want to go to an academic center, university, they are the best to treat those types of spine problems. But thank God, tuberculosis is extremely rare in the United States. As a matter of fact, I've only seen one case in my entire career of 29 years in America. But they happen all the time in India and Pakistan and countries like that because unfortunately a lot of people aren't vaccinated and they get tuberculosis. It goes to their spine and it eats your spine up. That's a very difficult disease to treat, requires a lot of different doctors of different specialties, including infectious disease and neurosurgery and neurology and physiatry and therapy and others. So it's not something you can simply treat at Duke Spine. However, everything else, the other 99 99.5% of the causes of back pain. Duke Spine Institute is the first medical clinic in the world to be able to cure back pain in every patient. And all we need is for you to come here and we can cure your pain. We have been doing this for 21 years at Duke Spine. I've been doing it for 29 years in my career. We have the best team in the world right here. These are not surgeries you can get done anywhere else in the world. We pioneered them here at Duke Spine. Endoscopic surgery can be done, but it's not the same as what we do. We've been doing this surgery now for 19 years. As a matter of fact, just going over 19 years. Any other questions?
At this moment, no current questions, so we do just have a comment coming from Ponlus, once more on YouTube, saying thank you.
Welcome. Then let's show the audience, how is it, what is, we've looked at the video on 30 causes of back pain. We know that disc injuries are the most common cause of back pain. And we have different names for disc injuries, folks. I want you to pay attention. This is another source of tremendous confusion in the world. These are all pieces of herniation, by the way, that are coming up. They're floating out in the liquid, water, saline, cold saline, that's sterile. There are these 30 causes of back pain, but one of them accounts for 85% of all back pain, okay? When you think about this cause, think about like the oceans of the world, right? Most of the earth, 70% of the earth, is covered by water. This is 85% of the causes of back pain, and it is disc injuries. These have different names, but they all are the same. There's nothing different about them. Herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, spondylosis. These are all disc injuries. They're all the same. It's a tear in the wall around the disc called an annular tear, followed by a squeezing out of the nuclear material or jelly in the middle of the disc called the nucleus pulposus. And all of these disc problems arise from the same cause. It's called trauma. And people have trauma in their life to their spine. They injure their disc, and then later on in life, those discs become symptomatic, causing back pain. Or if it's in your neck pain. So, Henry, let's show our audience, how is it that disc injuries lead to back pain?
Of course.
Disc injuries start with an annular tear. Damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from our video that Henry just played, how is it that trauma leads to back pain? And the answer is trauma causes tears in the wall of the disc. When those tears are in the back wall, take this, then the herniations of nuclear material can come out through the tear. That's what we're seeing right here, folks, right there. You guys see that? And then
Yes,
those
we do.
herniations stuck within the annular tear cause inflammation within the annulus. And that's where the back pain comes from. So we're going to show you a video in a moment on how this surgery actually works to get rid of chronic back pain from disc injuries. But before we do that, I want to say this patient is actually over 80 years old. Over 80 years old. All right, he's from Mississippi. He came here with his son, who's taking care of him while he's here. And they showed up yesterday, having surgery today from Mississippi. And, you know, what he told me was nobody wanted to touch him because of his age. But we don't mind doing the surgery on an 82-year-old. Why? Sorry, 88. 88 years old.
Your math is off. I just did it.
So anyway, long story short, he's 88, almost 90 years old, but he's healthy. And what he said to me was, Dr. Duke, 2 years ago, I was able to do everything. I was able to walk around. I was able to jump.
He was even farming.
Farming, yeah, he was doing everything. And then he got these symptoms in his legs with basically called neurogenic claudication from pinched nerves from the herniated disc. And it just debilitated him. He saw lots of doctors, and they all told him just live with it, you know, let it settle down, just settle down and die, basically. You're 88, just stop enjoying life, just sit in a chair and spend the last of your life in a chair waiting to die. Well, this guy wasn't okay with that. So he found Duke Spine, talked to me. I said, you know, yeah, you're 88, but people are living much longer these days than they have in the past, and you're a healthy guy. You know, you're not like sitting on death's doorstep. You got perhaps years ahead of you. And the question you have to ask yourself is, do you want quality in your life, or do you want to just sit on a sofa the rest of your life and until you just rot away until the day you die? There's a piece of herniation coming out. So he chose to live, which I would recommend all of you choose to live. Don't let your pain rule your life. Come to Duke Spine, let us cure it. Stop worrying about money. You can't take your money to the grave. Pay the money to get your back fixed properly, safely at Duke Spine Institute. Why? Because when you go elsewhere, they're going to fuck you up big time. How do I know? I see patients all the time in my clinic that have gone elsewhere, had discectomy or laminectomy or fusion, and now they have nerve damage or they have infection or they have other complications from those surgeries. I'm not making this stuff up, folks. I just saw a patient last week, had surgery here locally, woke up from the surgery and could not move his leg. His whole leg was numb and weak. Why? Because the surgeon basically damaged his nerve root during the surgery. Okay, these surgeries are being done right next to the nerves in your back. And most surgeons, they're just terrible. They're not well trained. They don't have the skill, the knowledge. They don't have the care. And they hurt patients, and guess what they say? Well, you signed the consent form. You knew that was a risk, and you decided to have the surgery, even though nerve damage can happen. That's what they say. But the reality is, folks, back surgery can be done without nerve damage. I have never in 29 years had a nerve damage, and all I do is operate next to the nerves. Well, why is that? It's because in the spine world, I am the Messi of spine, or the Ronaldo. You pick it, whoever your favorite is. All right. So when you're building a professional soccer team, do you want the best players in the world, or do you want just schlubs? I know what I want. I want the best. And if I'm going to have surgery, I want the best surgeon to do my surgery. It makes a difference. And that's why this patient traveled from Mississippi to Florida for me to do his back surgery. He actually cares about his outcome. Now, we had a comment about the cost of the surgery from one of our viewers, right?
Correct.
And the comment was,
Yes.
I didn't understand why, if I had surgery in a certain amount of time, the cost was one cost, and if I didn't, it was a different cost that was more.
Correct.
The answer is we do run specials at Duke Spine, okay? And those specials mean you're going to get a savings passed on to you, the patient. And typically those specials are run because we have, for example, we may have some surgeries already scheduled, and having your surgery done, there may be a cost savings to the company where we can offer you a lower cost because other people are having their surgeries done at that time. And therefore, the cost is not as great to the company to run the operating rooms and have the nurses here and all the other things. So that's why we have special prices. That's answering that person's comment, I think.
I believe so.
Yeah. So just about done with the second disc. We're going to move on to the third one in about 5 minutes. I'm just at the outside of this L3-4. And this disc definitely needed to be treated. The patient was asking me yesterday, do I need to treat this L3-4? And I said, yes, I recommended it. And it's, in my opinion, causing problems for you. And sure enough, that's what I'm seeing. You can see a lot of herniation. You can see a lot of inflammation, the red stuff that we just zapped away. This is herniation right here, the blue stuff. So, yep, it's going very well for him. How's he doing, Dr. B? Remember, he's 88 years old, 88. So we don't discriminate for surgery based on age at Duke Spine. We don't, okay? A lot of doctors will not operate on you if you're older because they don't want to run the risk of hurting you and getting a lawsuit. We have such a gentle surgery, so minimally invasive and so safe that we're willing to treat people even in their 80s and 90s. Okay? We believe people should have the right to decide if they can be fixed or not. It's not a doctor's decision, it's a patient's decision, in my opinion. That's respecting the patient's wishes. The doctors that turn patients away for curative surgeries like this, they're just protecting their own asses, all right? They're just caring about themselves. And the fact is, those doctors probably shouldn't be doing the surgery anyway if they're that worried about hurting the patient. So it's probably a good thing they're refusing to do the surgery. But at Duke Spine, we're not going to turn you away because of your age. Huh? I can't even hear what you're saying. No, come on. Seriously? All right. Any other questions?
Yes, we have a couple more questions. These next two are coming from Faisal on Facebook.
Faisal. Awesome. Welcome.
Asking, first question, Doctor, is it dangerous to use nerve pain medication for a long time?
Is it dangerous to use nerve pain medication for a long time? 100% yes. Any medication you're taking for a long time is dangerous because all medications have side effects and they can be toxic. I don't know which nerve medicine you're using, but common nerve medicines like Neurontin, gabapentin, pregabalin, Lyrica, those are the trade names and the generic names. Those are nerve medicines. They can destroy your kidneys and liver, and they have other effects on your brain. I would highly recommend you do not take nerve medicines long term. All right, great question. I do want to say something. Duke Spine Institute, if you go to our YouTube channel, we have recently published several very good spine scam videos about various topics. One of them is the insurance companies refusing to pay for treatment on a patient, who the patient called their insurance company and asked why, and they told her because you should be doing narcotics instead of surgery. So they were recommending she use narcotics, which, by the way, are illegal to be used in Florida for chronic pain of non-cancerous origin, which she has back pain that's totally fixable with surgery here at Duke Spine. The insurance just doesn't want to pay for it, so they told her to do narcotic pills. Crazy. And we have a video on that. It's Berkshire Hathaway is the name of the insurance company, by the way. Good old, what's his name?
Warren Buffett.
The billionaire Warren Buffett. His company advising patients, they're not even doctors, by the way. These are adjusters telling the patient to take narcotics for her back pain, chronic back pain. Unbelievable. But it's real. It really happened. Okay. So there's that video. We have another video on the denials that are happening in healthcare every year. That's been reported by the Wall Street Journal of 850 million denials for treatments by doctors and hospitals of patients every year by insurance companies. 850 million, folks. It's out of control. These insurance companies are so greedy. All they want to do is deny paying treatment and keep the money for themselves as profits. So you guys got to be aware of this because it's only getting worse. 1 minute. And then we have other reaction videos. We have a pain management doctor here who was basically cheating and reusing supplies she shouldn't have been, and she infected 20 patients with hepatitis C virus, which is a virus that gets in your body, it stays in your body and never leaves, and it kills you over time by destroying your liver. It melts your liver away, eats your liver up. So she infected 20 patients, and the Board of Medicine has now basically sanctioned her and taken her license. She's a pain management doctor who was basically cutting corners to save money so that people like you can have cheaper procedures that are paid by the insurance, but she put the health of her patients completely at risk, and now she's lost her license. But here's the biggest issue. Who cares if she lost her license? There are now at least 20 people known with the diagnosis of hepatitis C that are going to die in the next few years. And the reason is cheap medicine. You guys are all complaining about the cost of medicine. Well, there's a reason good medicine costs money, more money. There's a reason why you're paying $40,000 to have surgery at Duke Spine. It's because the insurance companies don't want to pay for quality, period. They just keep driving down the price, and doctors are forced to cut corners to stay in business. Duke Spine will never cut corners. We will always provide safe, high effective care, and you're going to save your money long term because your back pain's gone, and you don't have to keep going to pain management doctors, okay, and getting treatments. That's why you come to Duke Spine, because you want safe treatment that's not going to hurt you or kill you, and you want treatment that works so that you can get on with an active life. And people that don't understand that, I don't know what else I can do to tell you and explain it to you. When I go to the doctor, I want the best care possible. I don't want to come out of my treatment with a complication and be worse off. And that doesn't happen at Duke Spine. You don't get complications. All right. We're going in to fix the L4-5 on the left. Shot, any questions?
We have a couple more questions. This next one from Faisal, once more on YouTube, asking, Doctor, if trauma causes a disc or facet joint to be painful, then why do some doctors and surgeons think some are caused by degeneration due to old or older age in time? Thank you.
Yeah, Faisal, great question. So, Faisal asked, Dr. Duke, you're saying trauma is the cause of facet pain, but other doctors say it's arthritis. No, we're both correct, Faisal. I'm saying trauma causes the arthritis. The arthritis causes the facet pain. So we're saying the same thing. They're just saying arthritis comes with age. Arthritis does not come with age. I have seen 90-year-olds with zero arthritis. They're 90, folks, 90. So if arthritis came with age, then why don't 90-year-olds have arthritis? All of them. The answer is because it doesn't come with age, it comes with trauma. The older you are, the more time the trauma has to, the old trauma has to cause arthritis. So it is arthritis, and those doctors are correct, but the arthritis is there because you're going to have a hard time because it looks like it's locked. Go ahead. The arthritis is there because of trauma. Yeah, we got a little cold welding. What? Here. A little cold welding, which means that, what are you going to do?
I just want to twist it a little bit.
Huh? Twist it?
Yeah.
Twist and shout. So what's happened is when I put the tube over the dilator, a little bit of disc material got stuck between the tube and the dilator, and now, I would use the Raytec, no? And now they're kind of stuck together. So trying to get the dilator out, and it's not working because they're stuck together from the herniation that's in there. I'm going to try to, with Luis's help, try to remove it. Any questions?
Yes, we
But
have a couple.
these are the kind of challenges we encounter day to day, doing our job. And, you have to be resourceful as a surgeon in order to avoid having really bad issues happen. Like right there, who knows, some surgeons would make the wrong choice. I've got Luis here. Luis is highly experienced. That's what your $40,000 is paying for, okay? And by the way, for those of you who don't know, spine surgery is the most expensive type of surgery in the world. In the United States, spine surgeries cost between $50,000 and $500,000 depending on how many discs are being treated, how much hardware is being put in. I mean, there's many factors, but those are typically fusion cases. But for laser, we try to keep it as affordable as possible, but this is the most advanced technology in the world. It's going to be, should be more expensive than fusions, but we keep our costs pretty low.
Speaking of, we have a comment coming from Tom once more on YouTube, following up on his previous comment on costs, saying, "Now I understand the costs. Thank you. You are very impressive in your work and your confidence. It's easy to see that you have done this many times. I appreciate a skilled trade."
Thank you, Todd. Yeah, Todd, so here's the truth, okay? I don't want to take $1. Duke Spine doesn't want to take $1 from any patient. We want the insurance companies to pay for this surgery. But here's the problem. Every dollar the insurance companies pay for this surgery is at $1 less profit they make at the end of the year. And insurance companies are greedy. They don't care about you, the patient. They don't care about the kind of surgery you're getting. As a matter of fact, the insurance companies really want patients to only have the worst possible surgeries available to them, because then you will decide not to have the surgery because you're going to get mangled during the surgery. That's their goal. Their goal is to basically cover surgeries that patients don't want. You understand? That would be like me selling you a meal plan at my restaurant where you can come and have food anytime you want. You pay $100 a week for the meal plan, and I serve, I'll serve you, this week on Monday we're going to serve guinea pig brains. On Tuesday we'll serve sheep intestine soup. On Wednesday we'll serve, monitor lizard testicles. That's what's for lunch. So now, are you going to go and have those meals? Hell no. You're going to pay the $100 and then you're going to say, hell no, I'm not having this. And I'm going to stop paying the $100, right? But with the insurance companies, they lie to you and tell you how great their insurance plan is. And then when you actually need it for like an advanced treatment, they don't cover it. Okay? They don't cover it. And believe me, I'm not the only one that they don't cover. They make 850 million denials a year. So, Duke Spine probably has, 500 denials a year. So that leaves 850 million minus 500 a year. You're looking at non-Duke Spine denials for treatment at 849,999,500, right? So there's a lot of denying happening in America today that wasn't happening 40 years ago. 40 years ago when I was a kid, or 50 years ago when I went to my dad's office to do my homework after school, and he was treating patients, the insurance companies didn't do denials 50 years ago. There would be 1 million denials maybe in the whole America in 1 year. Now we have 850 million a year. Okay? That's 50 years. That's just one generation difference. And it's gone from 1 million a year to 850 million a year. Next year it'll be 1 billion, by the way, easily. So why are the insurance companies denying paying for treatments like this? Because every denial they do, they make more profit. They're taking your premium dollars and they're not paying for your claim. Therefore, they keep the money. Now, you might say, but that should be illegal. You're right, it should be illegal. But the insurance companies write the law. They write the law. They spend hundreds, millions of dollars a year paying politicians and lobbyists in Washington and at every state to basically write laws that allow them to not pay for your care. And you don't know about this because they do it quietly, they do it secretly, and they hope you never find out. But I found out about it, and I'm making people aware of it. They need to know the truth. These insurance companies are going to keep denying until somebody holds them accountable. I'll make one more point about that. Look at the Trump administration, right? Donald Trump and his administration. They came out like a raging bull on day one. They're 100 days now, okay? He's attacked everybody except one group. And guess what that is? Insurance companies. Why is it that the Trump administration will take on every single bad guy in the world except the insurance company? The answer, the insurance companies are above the law. They are above the Trump administration. Elon Musk, Donald Trump, nobody's paying attention to or talking about how they're ripping our country off to the tune of trillions of dollars a year. Trillions, not billions, not even hundreds of billions, trillions. And I can see it all. And Dr. Oz won't do shit about it. Yeah, he's a distraction, right? Oz is a distraction. What's his name? Kennedy is a distraction. They have no clue. They have no clue what's really wrong. And yeah, of course I agree. Sugar, there's too much sugar in the diet, right? Autism is important, very important. Yeah, right. But our biggest problem is the insurance companies. They are killing our country, killing it. So anyway, getting back to my point, I have no desire to take money. However, if I don't take money from the patients, our company doesn't take money from the patients, we will basically go bankrupt overnight, and it will be overnight. Our overhead is massive. So we have to charge money to cover our expenses. I have no problem telling people our overhead is $600,000 to $800,000 a month, every month. That's our overhead. And my salary, which I get paid from that overhead, I get $400,000 a year, which if you look at the average neurosurgeon, they make $800,000 a year. So my salary is half of what the average neurosurgeon in America's salary is. And yet here I am, the pioneer of this technology, the first to cure back and neck pain in the world, and yet I'm making, most people would say it's still a lot of money, and I get it, but it's a pittance. For a guy who works full-time to help patients, it is a pittance. So, when money comes up, I absolutely disgusts me when people bring that up as an issue. Our church in Orlando just raised $80 million to build a new building that honestly they don't even need, and people are donating their money out of their pockets to the tune of 80 million, 100 million. You know, over the years, I'm sure it's been $1 billion they've gotten, and yet I can't even get enough money from people to fix their backs forever and make their lives better. I can't get enough money to keep my company going. It's absolutely stupid. So I hate these discussions about money. They make me sick. But there is a reason, and it's your insurance companies are getting away with not paying. And you're letting them. You, the patient, is letting them. So I'll tell you one last thing, since I said one last thing before, and I got 3 minutes left. We're getting ready to sue Blue Cross for not paying for the surgery, okay? And one of my patients I saw, he has, we're very selective about which patients we're bringing into the lawsuit because we want to win. And so they have to have a certain type of plan, and Blue Cross has 5,000 plans with different language across America. This patient has the perfect plan. He's going to join 5 more patients with the perfect plan so that we can sue Blue Cross, hopefully win, and get them to start paying for the surgery and then off to United Healthcare. Okay? But we asked him, please, please, please help us by joining this group of 5 patients to sue Blue Cross so we can get coverage for the surgery. And he said, no, I'm not going to do it. I just don't feel like it. All right? And there's your problem, folks, apathy. And it makes me sick. I have spent $10 million of our company money over the last 20 years to get this surgery approved. I've spent thousands of my own hours, and yet when we ask a patient to advocate for themselves and do absolutely nothing but be willing to take on their insurance company, have a judge decide should the surgery be covered, and the patient says no. You know, there's nothing that I detest more in life than ungrateful people. So if you come to my office and you meet me and you're ungrateful for what I've done, you will find the door, the exit door. I don't give a shit how much money you have, because that's not important to me. What's important to me is an appreciation for what's being done for you, by me. The sacrifices I've made for my company, my family's made for you guys, that matters most to me. I will fight for people as long as the people appreciate my fighting. If they don't, then I'm gone. And it's that easy, that quick, right? And back pain will remain a mystery for the next 100 years or longer because doctors will not want to cure it. Doctors don't want to cure back pain, just so you know. They want you to live in pain so they can make money off you every time you come in every month for your treatments. Same thing with cancer. They don't want people cured of cancer, so they keep making money off of them. I am a different breed. I want to cure you. I want to get rid of your pain permanently. But I'm like the only one in the country that's advocating for this. So you need me if you want to be out of pain. And you guys better learn to respect my company and treat it well, and stop criticizing it for asking for money from you when your insurance company won't pay. All right. There you go. You opened a can of worms, as they say. I got 30 seconds left. I'll take questions, but we're just about done. This is L4-5, patient's left side, and it's gone really well. We're just about finished. Any questions?
Yes, we have a couple more questions. This next one is coming from Scott once more on LinkedIn.
Hi, Scott.
Asking, as a business analyst, I'm curious to know where most of your referrals are coming from.
Most of our referrals come from exactly where you are right now, YouTube. And they come from patients that we fixed. They refer their family and friends. Our biggest problem, as you know, is cost for the patient. It's high. We can't fix that right now. We need the insurances to pay, and it's very hard to get them to pay. Workman's comp does pay because they love our surgery. It's minimally invasive and it works, and they love it. So we do get work comps to pay, but that's because work comp's unique. It's a different kind of insurance. They actually own the patient's injury the rest of the patient's life. So they actually are motivated to fix the patient properly so that they don't have to keep paying for the patient's medical care. But other insurances like Blue Cross, they only own the patient's medical problems for a year while the patient is on that plan, and every year they renew the plan or don't through the employer or through the marketplace. So the the typical insurances, commercial insurances like Blue Cross, United Healthcare, Cigna, Aetna, and Humana, they really don't own the patient's back injury the patient's whole life. They only owe it while the patient's working. And guess what happens to people with bad back pain? They quit working. So then they lose their job, they lose their insurance. And then the Cigna or Blue Cross doesn't have to pay for their back problem anymore because they're no longer working and no longer have insurance. But work comp is unique in that when you get an injury to your back, you actually, the work comp has to pay for it for the rest of your life. So the work comp carriers actually do care about getting the patients fixed properly because they don't want to pay for the patient's back problem for many, many years. Does that make sense? So it's a screwed up system, but ultimately our patients' referrals are primarily through YouTube and primarily from other patients. I can't get the IABand off here. Go ahead. Any other questions?
Yes. Next question coming from Thunder and Lightning on YouTube.
I love it. Thunder and lightning. By the way, folks, take a look at the incision. This one's about 8 millimeters. No, you don't see that. But we did both sides because he had both legs bothering him. Tiny, tiny incision. By the way, I think did he have a microdiscectomy done in the past? He did, right? He had a microdiscectomy done. I'm pretty sure. He has a scar there. Yeah, he did. So that microdiscectomy obviously didn't last, and he's here at Duke Spine for a real surgery. All right, next question.
Thunder and Lightning on YouTube asks, does Medicare and Medicaid cover this surgery?
Medicare does not cover the surgery. Medicaid does not cover the surgery.
Next question coming from Kit on YouTube.
Yep.
Asking, if I have an L4-5 to L5S1 fusion with you, how many days do I have to stay in Florida?
So if you have an L4-5-5-1 fusion with me, it depends on how we do your fusion. If we do it arthroscopically like I just did, then you could go home the next day. And if we do it with an open fusion with screws and rods and cage, I would recommend you stay 1 week. 1 week.
And then lastly, coming from Frank on YouTube, once more on YouTube, asking, if a patient had previous ACDF surgery and the surgeon didn't get all of the disc out, are you able to go in with the laser and fix it without redoing the fusion all over again?
So great question. The answer is no. If you've had an ACDF with a cage and a plate, I cannot go past the cage and plate to get to the herniation behind them and fix it with a laser. I would have to do a revision of your ACDF. I'd have to take your plate out, drill out your cage with a drill, and then microscope, and I would have to remove the herniation behind the cage and then refuse you.
And that is it for questions.
All right, folks, today is a busy day. We got 2 cervical cases, which is uncommon. Our next patient has 2 herniated discs in the neck. We're going to be doing a 2-level cervical Duke laser disc repair. And the next patient also has a single-level cervical herniation. We're going to do a Duke laser disc repair of a herniated disc in the neck on that patient. And the last patient has 2 herniated discs in the back plus a piriformis syndrome. So we're going to do the Duke laser disc repair lumbar bilateral, I think it is, or 2 levels. And then we're going to do a piriformis release. So that's our day. It's a busy day. Stay with us. Grab some popcorn and soda. We'll see you back in 30 minutes.